All right, here's one way that really compelled me when I first learned about it in undergrad. Imagination tasks. So one study in particular asked participants with locked-in syndrome to either imagine playing tennis or imagine navigating their house. We know from previous research that those two things involve totally different brain regions. Playing tennis is a physical activity that activates the supplementary motor area, and navigating a house is a location-based activity that activates the parahippocampal place area, or PPA. So using this to their advantage, researchers told patients to imagine certain things in order to communicate. So if the patient wanted to answer yes to a question, they would imagine playing tennis, which activates the motor area shown here in reddish orange. If the patient wanted to answer no, they would imagine navigating their house, which activates place areas such as PPA shown here in the lower blue blob. It turns out that the brain activity of these two imagination tasks looks identical in both patients and healthy controls. Thus, if patients can intentionally imagine certain things and the appropriate brain regions activate, not just reflexively activating to a sound or visual stimuli, but goal-directed activation, one can predict that they are fully conscious and are just experiencing a locked-in syndrome. Okay, here's a fun video describing another cool way to help locked-in patients communicate.